Did you know that your skin can be a reflection of the health of your liver? Often, signs of liver problems, such as fatty liver and cirrhosis, appear on our skin long before other symptoms appear. In this video, we'll explore 11 skin changes that could indicate liver disease, offering you a practical guide to recognizing common signs and taking quick action. If you're concerned about your liver health or simply want to better understand how to care for your body, this is the perfect opportunity to discover how these skin changes can be a vital clue. Don't let liver problems go unnoticed. Follow along and find the solution to keep your health up to date. Skin discoloration, jaundice, occurs when bilirubin levels are high. Jaundice is a condition in which the skin and whites of the eyes turn yellow. This happens due to the accumulation of bilirubin in the blood, a yellow pigment resulting from the decomposition of red blood cells. Normally, the liver processes bilirubin and excretes it from the body. However, when the liver is compromised, whether through inflammation, infection, or scarring, cirrhosis, it cannot eliminate bilirubin effectively. This buildup of bilirubin causes skin discoloration, ranging from a mild yellow to a more intense brown, depending on the amount present in the blood. In addition to the skin, jaundice can affect other areas, such as the whites of the eyes, which also turn yellow. This symptom is often the first visible sign of liver disease and should be investigated immediately. Jaundice may be accompanied by other symptoms, such as dark urine, pale stools, and severe itching. These additional signs reinforce the need for a thorough medical evaluation to determine the underlying cause of jaundice and initiate appropriate treatment. Importantly, jaundice can result from a number of conditions in addition to liver disease, such as problems with the bile ducts or gallbladder, and even hemolytic diseases that cause red blood cells to break down excessively. Therefore, an accurate diagnosis is essential to direct the correct treatment. Spider angiomas are clusters of blood vessels that resemble spider webs. Spider angiomas are small lesions on the skin made up of a group of blood vessels that expand from a central point, creating an appearance that resembles a spider's web. These lesions are often visible just below the surface of the skin and can vary in size. The central point is usually red and the vessels radiate outwards in the form of fine lines. Spider angiomas are commonly found on the face, neck, arms, and upper torso. Although they can appear in healthy people, their presence in large numbers is often associated with chronic liver diseases, such as cirrhosis. This occurs because the diseased liver cannot metabolize hormones correctly, leading to an increase in estrogen levels, which can cause these lesions to form. These lesions are painless and do not cause physical discomfort, but their presence can be aesthetically worrying for some people. Furthermore, its observation can provide important information about an individual's liver health. If there are multiple spider angiomas, especially in combination with other signs of liver disease, it is crucial to seek medical evaluation. Other conditions, such as hyperthyroidism, rheumatoid arthritis, and pregnancy, can also cause spider angiomas. However, when found in large quantities, they have a high specificity for chronic liver disease, with an accuracy of about 95%. Palmar erythema causes redness on the palms and soles of the feet due to liver disease. Palmar erythema is a condition in which the palms of the hands, and occasionally the soles of the feet, have noticeable redness. This redness is caused by increased blood flow to the surface of the skin and may be a sign of chronic liver disease, such as cirrhosis. This condition is characterized by reddish spots that appear on the raised areas of the palms, particularly at the base of the thumb and little finger. The redness is usually symmetrical, affecting both hands. In some cases, there may also be a sensation of heat, tingling, or even pain in the affected areas. Palmar erythema occurs due to hormonal changes caused by liver dysfunction. The diseased liver cannot properly metabolize hormones, resulting in elevated estrogen levels in the blood. This increase in estrogen causes blood vessels to dilate, leading to the redness characteristic of palmar erythema. Although palmar erythema can be a sign of several conditions, including rheumatoid arthritis and pregnancy, its presence in individuals with risk factors for liver disease should be taken seriously. Observation of this sign should prompt further investigation to assess liver health and determine the underlying cause. If you notice persistent redness on your palms or soles, especially if accompanied by other symptoms like fatigue, jaundice, or spider angiomas, it's important to see a doctor for a full evaluation. Paper money skin refers to surface capillaries that resemble the silk threads on dollar bills. The expression paper money skin describes a type of skin change seen in patients with liver cirrhosis. This condition is characterized by the presence of many fine, superficial capillaries that are irregularly distributed on the skin, especially on the upper trunk. These capillaries resemble the silk threads found on dollar bills, which gives the condition its name. These thin, superficial capillaries are visible on the skin and have a paper thread-like appearance. The condition is caused by the dilation of small blood vessels due to increased pressure in the portal vein, a common effect in liver cirrhosis. This high pressure occurs because the scarred liver is unable to allow normal blood passage, forcing it to seek alternative routes through the small vessels in the skin. Paper money skin is one of several signs that can indicate serious liver problems. Although it can be confused with other conditions, its association with cirrhosis is quite significant. The presence of this type of skin change should prompt further investigation to confirm liver health and assess the degree of liver damage. In addition to cirrhosis, other liver conditions can also cause similar skin changes. Therefore, the diagnosis needs to be made by a healthcare professional, who can perform appropriate tests to determine the exact cause and recommend appropriate treatment. Paraumbilical veins may swell due to portal hypertension in cirrhosis. Paraumbilical veins, which are the veins located around the belly button, can become visibly swollen and dilated in cases of liver cirrhosis. This phenomenon occurs due to portal hypertension, a condition in which there is increased pressure in the portal vein, which carries blood from the gastrointestinal tract to the liver. In cirrhosis, the liver becomes fibrous and rigid, making it difficult for normal blood flow through it. As a result, blood is forced to look for alternative routes to return to the heart. One of these routes is through the veins around the belly button, which eventually dilate and become visible under the skin. These swollen veins can appear as a network of blood vessels around the belly button and are often described as Medusa head veins. The presence of these veins is a physical sign that blood pressure is high in the portal vein, which may be indicative of advanced cirrhosis or other serious liver conditions. In addition to being a visible sign, portal hypertension can cause other symptoms such as ascites, accumulation of fluid in the abdominal cavity, and abdominal discomfort. Identification of dilated periumbilical veins is important for diagnosing and monitoring the severity of cirrhosis and can help direct treatment to reduce portal pressure and alleviate associated symptoms. If you notice dilated veins around the belly button, it is essential to seek the advice of a doctor to evaluate liver function and determine the underlying cause of these changes. Decreased clotting factors in liver disease leads to easy bruising or bleeding. One of the essential functions of the liver is the production of blood clotting factors, which are proteins necessary for the formation of clots and the prevention of bleeding. When the liver is compromised by chronic diseases, such as cirrhosis, its ability to produce these factors is reduced. This leads to a decrease in blood clotting, resulting in easy bruising and unexpected bleeding. Patients with liver disease may notice that they bruise more easily, that small traumas cause larger bruises, and that bleeding, such as those from the nose or gums, is more difficult to stop. Additionally, small red spots may appear on the skin, known as petechiae, which are signs of bleeding under the skin due to fragile blood vessels. The lack of adequate clotting factors in the blood means that clotting does not occur efficiently, increasing the risk of bleeding and making wound healing difficult. This can be particularly problematic in situations requiring surgery or invasive procedures, where controlling bleeding is crucial. In addition to bruising and bleeding, reduced production of clotting factors can also affect the body's ability to control bleeding from minor cuts and stop bleeding after trauma. If you notice unexplained bruising, frequent bleeding, or red spots on your skin, it is important to see a doctor to evaluate your liver function and treat any clotting problems. Beer stains are hypopigmented patches on the limbs due to venous stasis. Beer stains, also known as port wine stains, are hypopigmented areas, lighter than the surrounding skin tone, that appear mainly on the arms and legs. These spots result from venous stasis, which is the stagnation of blood flow in the veins of the lower limbs. When blood does not circulate properly, it can cause these spots to appear on the skin. Venous stasis occurs due to problems in the venous system, which can be worsened by liver conditions such as cirrhosis. In cirrhosis, the damaged liver cannot process and metabolize substances properly, which can lead to increased pressure in the veins and, consequently, the accumulation of blood in peripheral areas of the body. This causes poor circulation that contributes to the formation of hypopigmented spots. These spots are usually painless and do not cause discomfort, but they are a visible sign that blood circulation is compromised. They can vary in size and shape and usually disappear when the affected area is lifted or pressure is applied. In addition to beer stains, similar problems can occur due to other health conditions that affect blood circulation, such as chronic venous insufficiency. However, the presence of these spots in combination with other signs of liver disease should be evaluated by a healthcare professional to determine the exact cause and necessary treatment. Xanthelasma are yellow growths near the eyelids, linked to cholesterol deposits. Xanthelasma are cholesterol deposits that form as small yellow plaques or growths on the skin around the eyelids, usually in the inner and outer regions of the eyes. These lesions are visible and often appear on both eyelids, giving the affected area a yellowish, shiny appearance. These deposits occur due to high cholesterol levels in the blood, which lead to the accumulation of lipids in the superficial layers of the skin. Although xanthelasma is most commonly associated with conditions such as hypercholesterolemia, high cholesterol levels, and heart disease, it can also be a sign of liver problems. The liver is responsible for metabolizing and excreting cholesterol, and liver dysfunction can result in excessive cholesterol accumulation in the body. Despite being a generally benign and painless condition, xanthelasma can be an important indicator of underlying metabolic disorders such as diabetes, hypertension, or liver disease. The presence of xanthelasma can signal that the body is dealing with lipid imbalances that can affect overall health. Clubbing, where the nails thicken and curve, may indicate liver disease. Digital clubbing is a change to the fingernails and toenails where the fingertips and fingernails become thicker and rounded, creating a drumstick-shaped appearance. This phenomenon occurs when the nails curve around the ends of the fingers and may appear wider and more convex than normal. This condition is often associated with several underlying diseases, including chronic liver diseases such as cirrhosis and hepatitis. In the case of liver disease, clubbing can occur due to chronic hypoxia, lack of oxygen, and changes in blood flow caused by compromised liver function. Lack of oxygen and nutrients can affect the growth and appearance of nails, resulting in this type of deformity. In addition to liver disease, clubbing can also be associated with other conditions, such as lung disease, such as cystic fibrosis and bronchiectasis, heart disease, and inflammatory disease. Therefore, its presence is not exclusive to liver problems, but should be considered as a sign that something else may be wrong with the individual's general health. If you notice significant changes in your nails, especially if accompanied by other symptoms such as abdominal pain, fatigue, or jaundice, it is important to see a doctor for a complete evaluation. Clubbing may be indicative of an underlying condition that requires investigation and appropriate treatment. Terry nails show white nails with a pink stripe at the tip and indicate systemic diseases. Terry nails are a nail alteration where most of the nail appears dull white except for a narrow pink or red stripe at the tip. This condition is often seen in systemic diseases such as advanced liver disease, congestive heart failure, kidney failure, and diabetes. The appearance of Terry's nails is caused by changes in blood circulation and nail structure. In the case of liver disease, the compromised liver can lead to a decrease in blood flow to the extremities, resulting in the white appearance of the nails. The pink or red band at the tip may be due to residual blood flow to the ends of the nails. This change in the nails can be a visible sign that there is an underlying problem that affects the overall health of the body. Terry nails are not specific to a single condition, but are an important indicator that a systemic problem may be present. Other conditions that can cause nail changes include heart, kidney, and metabolic problems. Observation of Terry's nails should prompt further investigation to determine the underlying cause and treat the condition appropriately. The presence of this change in the nails may be a sign that monitoring and management of a broader systemic health condition is necessary. Liver spots, or age spots, are small dark spots caused by sun exposure, not related to the liver. Liver spots, also known as age spots or solar lentigines, are small, dark, flat areas that often appear on sun-exposed areas such as the face, hands, shoulders, and arms. Despite the name, these spots are not related to liver disease. They are caused by the accumulation of melanin, the pigment responsible for skin color, due to prolonged exposure to ultraviolet (UV) rays from the sun. Over the years, continuous exposure to the sun can lead to an increase in melanin production in certain areas of the skin, resulting in the characteristic dark spots. These spots are common in people over 50 and can vary in size and shape. Although they are not dangerous and are not usually associated with serious health problems, they are a sign that the skin has been exposed to too much sun. Liver spots are different from spots caused by liver problems, which typically do not appear in areas exposed to the sun and have other characteristics. It's important to differentiate between age spots and other skin changes that could be signs of more serious conditions, such as skin cancer. Regular use of sunscreen and adequate protection against sun exposure are essential to prevent the appearance of these spots and protect the skin from sun damage. If you notice changes in the appearance of spots or new changes in your skin, it is always recommended to consult a dermatologist to ensure there are no underlying health problems. In this video about skin signs of liver disease, we learn that the liver plays a crucial role in overall health and that changes in the skin can serve as indicators of liver problems. Firstly, skin discoloration, known as jaundice, is caused by the buildup of bilirubin and can turn the skin and eyes yellow, signaling liver problems. Spider angiomas, which are clusters of blood vessels visible under the skin, can also indicate chronic liver disease, especially when they appear in large numbers. Another important manifestation is palmar erythema, characterized by redness on the palms of the hands and soles of the feet, caused by hormonal changes associated with compromised liver function. Paper money skin, with thin, shallow capillaries visible in the skin, is a sign of portal hypertension due to cirrhosis. Dilated periumbilical veins around the belly button may be a sign of portal hypertension and cirrhosis. Easy bruising and bleeding results from decreased production of clotting factors by the damaged liver. Beer stains, or hypopigmented spots, are a sign of venous stasis and circulation problems associated with liver disease. Xanthelasma, yellow deposits of cholesterol around the eyelids, may indicate high cholesterol levels and liver problems. Clubbing, where the nails become thicker and more rounded, can be a sign of several conditions, including liver disease. Terry nails, with a predominant white appearance and a pink stripe at the tip, are indicative of systemic diseases. Finally, liver spots, also known as age spots, are caused by sun exposure and are not directly related to liver problems. They are common with aging and prolonged sun exposure, but should not be confused with signs of liver disease. These skin manifestations can provide important clues about liver health and the presence of liver conditions, and any skin changes should be investigated by a healthcare professional to ensure proper diagnosis and treatment. Thank you for watching this far. Don't forget to subscribe to the channel to continue receiving the next content. Until the next video.